Good morning to all. There's a whole array of pupil expansion devices. They are flexible structures, device. They are employed to maintain the pupil in a dilated position throughout the length of the surgery. So in that we have the well-known things of BX rings, which gives a 5.5 mm pupil expansion in a hexagonal shape, which engages in 5 points. And we have the Malugin ring, which we have a injector. We need an injector for it, and it can be injected through a 2 mm incision, and it gives almost a nearly round pupil of 6 mm. And the modified version of Malugin ring is the Gupta ring, which has 4 scrolls, like 2 above the iris and 2 below the iris, and it's not a preloaded version, and it engages the pupil at 4 points, and it gives a dilatation in square shape. The latest addition to this collection is the AIOS pupil expansion, and it is developed by Aurolab. It gives an overall diameter of 8.3 mm, and it's made of silicon material, and it gives a uniform radial expansion. It's 360 degree. It will be attached with the iris, and it can be positioned with 4 positioning holes to engage and to remove. It gives an inner dilatation of almost 6.3 mm, and it comes with a preloader injector of which can be injected through a 2.8 mm. So this is how the device looks, and it comes with a disposable injector. The cartridge, this is a cartridge, and it fits with the 2.8 mm incision comfortably, but with wound assisted it can be injected to a 2.2 mm also. And here you can see the device which is inside the cartridge. So the OVD has to be injected in the cartridge before injecting the device. And first, while you try to engage the iris, there will be 2 grooves in this device. I'll be showing this. So there's the upper groove and the lower groove, and the iris pupillary margin has to be engaged with between these 2 grooves. So first try to distal edges engaged in the groove of the device. By we can use a Sinskey hook to engage the pupillary margin. It looks too bulky, but it's near. The reality is actually it is thin and flexible, and you can see this is the margin. So the important thing in this device is like it can be the 360 degree of the iris is engaged, and while engaging the last part of the ring, gently retract the iris to engage the pupillary margin in the groove. And it gives enough ample space also. So this is how the inner diameter will be 6.3 mm. So after implanting the IOL and before removing the visco, you can disengage with the same Sinskey hook. So there will be a minimal spincher tear, but it will give a post-operative. It will give a nearly round pupil, and you can remove it by using a McPherson's forceps or even with another Sinskey hook also. So the pupil shape is not much altered. Quite altered. So to summarize, this biocompatible silicon material based device is AIOS, which helps for smoother insertion and delivery. Its circular configuration results uniformly round pupil dilatation. It provides a 360 degree contact with the iris and achieving 6.3 mm dilatation. This device provides excellent working space, at the same time prevent inadvertent iris damage. Compared to all device, it is very economical also. The recommendation is in case of rigid pupil, especially in less than 3.5 mm, the stretch pupilloplasty should be done in any pupil before attempting any pupil expansion devices. Thank you.
I noticed that there is a lot of pigment dispersal, and because after you engage the lens into the groove, and when you removed it, there was quite a lot of, and also the edges were crenated after you. In a malignant ring, at least which I have used, you get a perfectly circular pupil, which with no dispersion of the iris. I mean, it costs much more, but I have been using it.
No, sir.
The other thing is that was when you implanted it and when you are doing was it if in a floppy iris syndrome, did this ring try to come out? Because some of the rings just come out from the flanges when in a floppy iris.
No, sir. It was like there were some difficulties in few of the cases, but in majority of the cases, it didn't happen anything, any trauma to the iris.
Okay. Thank you very much.
Can you reuse this?
No, no, no.
No,
ma'am, it cannot be no. It's disposable.
No, officially disposable, but can you ETO it? ETO it and use it? Because we use our malignant rings quite often.
Malusian ring we can use till it breaks.
And I have known, I've got the trick of how to keep it in.
Sterile it become little, the flexibility will be reduced. That's
I mean, I don't know. I hope people not recording this.
Okay.
Thank